who has the same condition as you, and she said she took several herbal and organic remedies. She took malunggay capsules, berry juice, guyabano leaves tea, barley and wheatgrass.
Good morning to our dearest breast friends. The long wait is over. Are you ready? Let us welcome this year's most anticipated event, Pink Perspective Year 3, with a theme, Together We Can Survive. I am Neslin Canonigo, your Master of Ceremony for today. To remind everyone, we are live, so we encourage everyone to share our live stream. And we are extremely excited to learn more about the breast cancer, its prevention and treatment, and many more. Have fun and stay tuned because we have fun surprises just for you. And kindly rename yourselves according to your organization. If you're part of our partnering organization, dash your name. And if not, rename yourselves according to your complete name as seen on the screen. Now, may we request everyone to feel the presence of the Lord for our opening prayer to be followed by the Philippine National Anthem.
Oratio Imperata for protection against COVID-19. Merciful and compassionate Father, we come to you in our need to seek your protection against the COVID-19 virus that has disturbed and claimed many lives. We ask you now to look upon us with love and by your healing hand, dispel the fear of sickness and death, restore hope and strengthen our faith. We pray that you guide the people tasked to find cures for this disease and to stem its transmission. We thank you for the vaccines developed, made possible by your guiding hands. Bless our efforts to use these vaccines to end the pandemic in our country. We pray for our health workers that they may minister to the sick with competence and compassion. Grant them health in mind and body, strength in their commitment, protection from the disease. We pray for those afflicted. May they be restored to health. Protect those who care for them. Grant eternal rest to those who have died. Give us the grace in these trying times to work for the good of all and to help those in need. May our concern and compassion for each other see us through this crisis and lead us to conversion and holiness. Grant all these through our Lord Jesus Christ, your Son, who lives and reigns with you in the unity of the Holy Spirit, God forever and ever. Amen. We fly to your protection, O Holy Mother of God. Do not despise our petition in our necessities, but deliver us always from all dangers, O glorious and blessed Virgin. Amen. Our Lady, Health of the Sick, pray for us. Saint Joseph, pray for us. Saint Raphael the Archangel, pray for us. Saint Roch, pray for us. Saint Lorenzo Ruiz, pray for us. Saint Pedro Calosod, pray for us.
Mga kababayan, ang pambansang awit ng Pilipinas. Kayang magiging telas ng sinakanan, alam ng puso, sa dikit mo'y buhay. Upang hinilang, tuyag ka ng magiting, sa manlulupin, di ka pasisingil, sa nagatak tutok sa simoy at sa langit mong panggaw, ay hinatang tulad, awit sa pagkayang minamahal. Ang isang ng matawad mo'y tagumpay na nagtitindig, ang bituin at araw niya kailan ang may di magtitindig. Lumalang araw ng warhaging pagsinta, buhay langit sa piling mo. Ang inigaya ng karnay mga amin, ang mga
To formally start this program, may I call on our ever supportive
Mga kababayan.
I'm sorry for that. I'm sorry for the technical difficulties. Again, good morning, everyone. Before we commence the program, we would like to remind everyone on our house rules. A gentle note for those who are in our Zoom conference room. Please do mute your microphone unless asked to unmute and turn on your cameras if your bandwidth permits. This webinar is recorded, thus we must be in our good behaviors at all times. May we request everyone to wear your appropriate attire for our photo opportunity, which will happen at the latter part of the program. And lastly, don't forget to stay home, stay safe, and enjoy the rest of the program. To formally start this program, may I call on our ever supportive in Polyanao Zone Coordinator 10A and the past District Governor of District 3860, and also the I Can Serve Foundation Incorporated Cebu Coordinator, Mary Ann Alcordo Solomon, for her welcome remarks. Please give her a virtual applause, please.
Thank you very much, Nelson. Good morning, everyone. Good afternoon, good evening to whatever part of the country you are. I believe we have participants from outside the Philippines. Thank you very much for joining us in today's Pink Perspective 2022. We're now on year 3. Apparently, year 1 became so successful. There was a clamor to come in with year 2 and again for year 3. That's why we have our how do you call this, Suki speakers who will continuously give us updates with their respective agencies and with the respective topics. Pink Perspective is actually initiated by the youth, the young ones, the Rotaract clubs of Cebu Fuente Community Base, University of San Carlos, University of the Visayas, together with the medical students of Cebu Doctors and their organization. We'd also like to thank the Rotary Club of Cebu Fuente and I Can Serve Cebu for their support in this Pink Perspective program. We want everyone with an open mind to listen to updates for today's program, which would be on Breast Cancer 101. It's never enough to learn about breast cancer because there's more to learn every year and more updates for us. And that is what I Can Serve is all about. We empower ourselves with information of what we have and what we can do with it. And we'd like to thank our first speaker who will talk about Breast Cancer 101. Most often, we hear questions or we are approached by people on financial support, and no less than our second speaker, newly appointed director for the Malasakit program of the Department of Health, Director Gurley Enriquez Veloso, is here to enlighten us. For tomorrow, part 2, we have Stories of Hope, actually the breast app, to be presented by Mikael Celdran, is a son of a breast cancer survivor. And we have the stories of hope from an iron woman who was at her best when she got breast cancer. She was very healthy. She was at her peak. And finally, I'll be sharing my story in this Pink Perspective program, the first in after 3 years. And we will be capped by Coping and Grief Management by Dr. Carmina Comendador Alvarez. So your mornings this Saturday and Sunday is, well, your time is in a rainy morning. So stay awake, be a sponge, and ask questions at the end of the presentation of each speaker. So thank you very much, Nelson. Thank you to all the participants. At present, we are 65 and we expect the numbers to grow in a little while. Considering that it's a bad weather, we want you to stay dry, stay warm, and stay safe. Happy Pink October. Back to you, Nelson. Neslen pala, Neslen. Back to you, Neslen.
Thank you for the wonderful words of welcome, Tita Mean, and for giving us a teaser of what will happen today and tomorrow. I am pumped up and excited to learn something new today. At this point, let us now watch videos from the I Can Serve Foundation.
In our 20 years of service, we've come to know these things to be true. Early detection is best. It's your right to know exactly what's wrong. You deserve the chance to right what is wrong. No one has to go it alone. You need a navigator and a roadmap to find the solutions for you. Hope is stronger than fear. Education is more powerful than ignorance. There is strength in partnering with like-minded groups. Local laws are binding. Working all over the country with different people and different mindsets builds strength, allays fear, corrects misinformation, and overcomes helplessness. As co-founders of the Cancer Coalition Philippines, we helped pass the cancer law. So the fight against cancer is every Filipino's fight. After 20 years, we've come to know these things to be true. The army of love, hope, knowledge, and power is always stronger than breast cancer. We are the I Can Serve Foundation, 20 years strong.
Can't smile without
Wow, I could see some participants singing along. It's a rainy day, but we truly can't help but smile seeing our titas from I Can Serve Foundation. As per Miss Leia Salonga, no one has to go it alone. You need a navigator and a roadmap to find the solutions for you, which is why hope is much stronger than our fears. Education is more powerful than ignorance. Through love, hope, knowledge, and power is much stronger than breast cancer. Indeed, the fight against cancer is every Filipino's fight, and that's from the I Can Serve Foundation. At this juncture, please let me help welcome Ms. Caitlin Alfar to introduce our first speaker for today.
Good morning, everyone. Thank you for having us once again for the third time. Pink Perspective is one of the events that we always look forward to each year, and I'm very excited to hear from our speakers today. I am very privileged to introduce to you our first speaker this morning. She is our breast friend, breastfeeding advocate, and breast surgeon from Chonghua Medical Arts Fuente. She also graduated Bachelor of Science in Biology, cum laude, in the University of San Carlos last 2005, Doctor of Medicine in Cebu Institute of Medicine last 2009, and had her postgraduate internship in the Philippine General Hospital last 2010. Also was a chief resident in general surgery in Chonghua Hospital last 2015 and had her clinical fellowship training in breast surgery, National University Hospital, Singapore last 2019. She is a fellow of Philippine Society of General Surgeons and fellow of Philippine Society of Breast Surgeons. She is affiliated with Chonghua Hospital, Mandaue, UC Med, St. Vincent General Hospital, Perpetual Socorro, and ACE Medical Center Cebu. And currently, she is a hands-on mother of two, cloth diapering, baby wearing, and breastfeeder. With great pride and honor, I am here to introduce to you the woman of the hour, whom we chose to be the guest of honor and first speaker for today's occasion, Dr. Kim Gonzalez Daroy.
Hello, good morning, everyone. I hope you can hear me and see me clearly. If you can anybody acknowledge, please?
Yes. So
Yes. All right. I'm sorry. I cannot share my screen. So if anyone can help me out with that, that would be really great. Yeah. Okay. So while I'm working on this screen share thing, you will have to excuse me a bit, no? I'm not so techy, so give me a little bit of time. I'd also like to say a few things about me. The introduction was a little bit outdated. I'm now currently living and practicing in Iligan City in northern Mindanao. I have just recently relocated from Cebu City. Yeah. Okay. So can everybody see my slides?
yes, Doc.
All right. So if it's okay, I would like to begin, and if I'm setting my timer up right now, I have 30 minutes. I think that's a lot of time, but maybe if
You are muted, Doc. Hello, Doc. You're still muted and we cannot hear you. I think your microphone is not working.
Okay, hello.
Yes, Doc.
All right, how about that? Hello?
Yes, Doc,
Yes, Doc.
you're audible
Audible
now.
na, Doc.
Oh, that's better. I am very, very sorry for the technical difficulties. And okay, so there, how about that? Can you all see my slides now?
Yes, Doc.
Can you hear me clearly? All right. So again, I'm gonna start my timer. And if I'll be talking way beyond the time limit, can just anybody tell me to, move on ahead or stop in the middle of my talk, okay? So this is gonna be just the basics of breast cancer. Okay. All right. So basically, when we talk about breast cancer, we have to know what cancer is first and why we need to talk about it. No? So cancer is actually, as you all know, it comes from our own body parts, right? It comes from a normal cell, which has a change, a genetic change, abnormality, wherein it becomes a different kind of cell compared to a normal cell, wherein these cells have a predestined function and predestined life. They grow, they multiply, they mature, have work, and then they die. The cancer cells, they do not have predestined work. So they continue to multiply and grow and continue to multiply and grow. And they have the capacity to invade local tissues wherein they grow. And for it to be cancer, it has the capacity to spread to other parts of the body. So that's cancer. And why is it very important? Because it does not have a self-destruct mechanism. The cancer cells have the ability to take over our normal body functions, especially if they go to the very important parts like your lungs, your liver, your brain. As you can see, I wrote it here, and it is well known already that breast cancer is the most common type of cancer among women worldwide. It has already overtaken all the other kinds of cancers. And among Philippine statistics, there is one source that says among 13 Filipinas, one of them will develop breast cancer in their lifetime. So that's quite a high incidence rate compared to in the Western countries, like in the United States. Their ratio is about is about 1 in 8, but that's because they have high screening for their patients as compared to third world countries like here in the Philippines, where most patients present only when they have difficulty with their large breast masses. So why do we need to talk about it? Because there really is the chance of a woman developing and men developing breast cancer is real. And what we know is that if we catch it early and we are able to treat it at an early stage, then we have the chance, we give the patient the chance of a long lifespan ahead of her. And the possibility of not dying from breast cancer. So that's basically why we are advocating for awareness. But as you can see in the Philippines, among Asian countries, the Philippines has one of the highest breast cancer mortality rates. I took this from the PSMO
site, and this was stated around maybe 2-3 years ago. The recent numbers say that our breast cancer mortality rates are getting lower, but not as low as, of course, in the first world countries. So again, why do we need to talk about it? Because it's there, and because we can help patients if they come in early. Okay, so I already gave an introduction of how cancer develops and how it behaves, but how does breast cancer develop? So as you can see in this illustration, we have a cut section of the breast. And if you look at the purple image, that is the actual breast tissue wherein you have your lobes and your lobules and your ducts. And the ducts are the ones that bring the milk that are formed in the lobes to the nipple where the baby will breastfeed, or where you will extract or express the milk. So if you cut one of the ducts, you see in this on the right upper side of your screen, one of the ducts, and you can see a normal breast duct has only a single lining of cells. And as you can see along the line, there are changes that happen there. So breast cancer does not happen instantaneously. We don't normally believe it when a patient will say, well, yesterday it was not there, but today I felt something on my breast. Because we know that there are changes that happen. And if you can see in this illustration, there are some sources that say these changes can happen over a span of at least 10-20 years. All right, so what happens is there's a normal duct, and then there's a genetic change, as I said, for cancer. When there's genetic change, then the cells that form inside the ducts are the abnormal cells, as you can see in the pink round and irregular cells in the middle, where it's labeled atypical ductal hyperplasia. So the first three, these breast conditions are not yet considered cancer. And as you go along the line, if these abnormal cells inside the duct multiply and are a lot of found inside the duct and still contained inside the duct, when we do a biopsy and see this description, we know that it's already called ductal carcinoma in situ, and we already say that this is our stage 0 cancer. And eventually, if these cells or this lesion is not caught earlier, these cells still continue to multiply and grow, and eventually they break through the barrier of the duct lining, and that's when you start calling it an invasive ductal cancer, and that's when you start labeling it as stage 1. Now, if you look below in the screen, you can see that there are many different ways for the cancer to spread. As I said, it's considered a cancer if it can invade the normal tissue or the local tissue wherein it grew, and it has the capacity to spread to other body parts. So for breast cancer, it most commonly spreads first through the lymph nodes, and that's why we also check our axilla, our armpit area, for enlarged lymph nodes in case there are any during presentation. And it can also spread via the venous and the arterial system. So usually if it passes through the venous system, it usually goes to the spine. If it passes through the arterial system, it usually goes to the lungs and the liver and the brain. So these are the most common sites of spread for breast cancer, or what we call metastases. And when we have evidence of spread already, then it is not considered stage 1, 2, or 3 anymore. But as we all know, this is what we call stage 4. So this is how a breast cancer develops. Now, so those are the very basics that we need to know. And because this talk is about awareness, I would like to pose this question. all throughout the rest of the talk. No? So is there anything that I can do to decrease my risk for developing or from dying from breast cancer? So the very first answer there is actually very simple. All we need to do is to live well and be well. So what is that? It sounds so simple, but what is that? So this phrase can be best explained by the risk factors for the development of breast cancer. So as you can see on the left side of your screen, you have the gold images, and on the right side of your screen, you have these orange images. So the most common risk factors for developing breast cancer is number one, being a lady, being female, babae, no? That we cannot change. And the second most common risk factor for developing breast cancer is aging. So as you grow old, the chances of developing breast cancer goes higher and higher. So that's female and age. And for the other non-modifiable risk factors, again, these are the ones on the brown or gold images, is our exposure. So as females, it's our exposure to estrogen. And I don't know if most of you understand this, but when we first have our menses, that's usually the first time that we are exposed to our estrogen in our body. And when we undergo our menstrual cycles monthly, then we are exposed to increases in our estrogens. No? So it's a monthly increase and decrease in the hormones. And as we menopause, then the exposure to our estrogen decreases. But as ladies, it does not necessarily mean that there is no more exposure after menopause. So again, for a risk factor for developing breast cancer, it's usually having your menarche or the first menstrual cycle at a very early age, and having your menopause, or when you cease to have menstrual cycles, at a later age. So those are risk factors for developing breast cancer. Of course, having a family history of having different kinds of cancers, especially for breast cancers in your first and second degree relatives, increases your risk. But it's not only breast cancer that we watch out for. We also watch out for pancreatic cancer, prostate cancer. These are a group of cancers that we consider in the family history. And it's usually more important if we talk about first degree and second degree relatives. So what are these? These are the first degrees relatives are your parents, your siblings, or your children. And the second degree relatives are, of course, the siblings of your parents, your cousins, or the cousins of your children. All right. And then another non-modifiable risk factor is your genetics. Genetics plays a minor role. No, it's not the most common reason for a person to develop breast cancer, but it plays a very big role. So if you have a genetic abnormality, usually what we know as BRCA 1 and 2, as in Angelina Jolie, if you remember, if we have these genetic abnormalities, then you have a very high risk of developing breast cancer. And not only that, you have also a high risk of developing ovarian cancer. And also, two more of the non-modifiable risk factors are if you have a previous history of having a breast biopsy, especially if that previous breast biopsy turned out to be malignant, then you have a higher chance of developing another breast cancer. And if you have a previous history of receiving radiation to the neck and chest area. So usually these are those patients who have had childhood lymphomas. So now I go back now. Our phrase was live well, be well. So there's nothing much that we can do for these non-modifiable risk factors. But if you look at these orange images, then these are the things that we can modify. And what do I mean by live well, be well? Number one, we strive and aim to avoid obesity. Why? Because the extra fat cells can be a source of extra estrogen in the body, especially in the elderly and those who have had menopause already. Alcohol, increased alcohol consumption, although it's not really a big risk factor. Our alcoholic intake to one, at least to only at most just one serving. So it's one bottle of beer or one shot of hard liquor per day. Other modifiable risk factors, so I'm very sorry, my son is here. Okay, so let me move on. Getting pregnant and getting multiple pregnancies and breastfeeding is also one of the modifiable risk factors. So why is this one of the risk factors? Is because if you are pregnant, then you have 9 months of not getting your menstrual cycle. Then you have 9 months of not being exposed too much of that high estrogen level. And if you do your breastfeeding, especially if you're a hardcore breastfeeder, then it can also delay the onset of having menses after you deliver your baby. So you have lesser exposure to your estrogen. Next to this is if we avoid exogenous or outside sources of estrogen. So what are these? These are our oral contraceptive pills or our injections. These are usually contraceptives. And for the elderly ladies, those who have had menopause, these are our hormone replacement therapy. So again, if we are exposed to too much estrogen, then we are at higher risk of developing breast cancer. And lastly, modifiable risk factor is if we increase our exercise, then we decrease our risk for breast cancer. So this is what I mean by live well, be well. Just try to be as healthy as possible. Right. Now, the next thing I would like to recommend, of course, is breast awareness. No? So basically, what we usually hear during these talks about breast cancer is breast cancer awareness. But what we as breast surgeons would like to recommend actually is, aside from being aware of the entity of breast cancer and being aware that if we catch it earlier on, we have a better chance of surviving from it, we should also be aware of our actual breasts. Why? Because if you're not aware of your actual breasts, you cannot catch it as early. Okay? I will explain further. So being breast aware leads us to doing self-breast examinations or breast self-examinations. Okay, so what is this? It's basically just you familiarizing yourself with how your breast actually feels like. Okay, so it's basically just that. In essence, we just want you to be able to know what your breast normally feels like. And to be able to do it properly, you will these are the steps that are involved. Now you have to use your 3 fingers. These are the pads of your 2nd, 3rd, and 4th fingers. You don't use the tips. Okay, so when you're examining your own breast, you don't use the tips, but you use the pads. And if you see this illustration, there's a clockwise, counterclockwise arrows. There's radial arrows, or the pattern sideways and going up. So actually does not matter what pattern you use when you examine your breast, as long as you choose one and you stick to one. So it's familiarity and doing it over and over and over again. And basically, you have to examine yourself in different positions. So first off, when you do examination, you have to be undressed, of course. And since it's self-examination, we recommend that you do it yourself. You don't ask like your boyfriend or your husband to check it for you, because sometimes we may forget the reason why we're checking, no, if it's our significant other. So we do it ourselves. So first we look at ourselves in front of the mirror to see if there are any abnormalities or changes. Mind you, our breasts are not exact duplicates, the right and the left. No, we think of them as twins. No, so one of them may be a little bit bigger, one of them may be a little bit smaller, but we usually just look for other changes like asymmetry or changes in the skin, which I will go into detail later. The second position is standing up. So when you check your breasts, if you're checking your left breast, then you have to use your right hand, and you have to raise your left hand over your head. Okay, so left breast, left hand over your head, right hand for examining. And that's the same step for examining yourself while you are lying down on the bed. So we need two positions. Why? Because there are some lesions that we can feel just over here at the top, right? So in the standing position, you can feel that. But there are other lesions that grow at the very deepest portion of your breast. So if you don't lie down and press down on your breast, then maybe you won't be able to feel them. Yeah, so basically, I'm giving you here 5 reasons to do your self-breast examination. Number 1, it does not hurt at all. Okay. Number 2, it's free, so you can do it yourself. Number 3, it's easy. Number 4, it's very fast, especially if you practice. No, so when are we supposed to do it? It's usually 1 week after the first day of your menstrual cycle. And you only need to do it once a month. Okay, there's no need to do it more than that. It's just once a month. So you basically just want to know how your breast feels. And of course, if you feel something, then that's a different story. And lastly, another reason for you to do self-breast exam is because it can save your life. And later on, you will understand why. So what are the things that we should look out for when we're doing our own self-breast exams? So as you can see, I took this out from the Know Your Lemons website. They put out these posters so that we do not discriminate from those with religions or social those that don't feel comfortable looking at pictures of breasts. So they use the lemons to depict what it is that we are looking for in possible breast cancer. So basically, it's changes in the skin, changes inside your breast, and changes in the discharges. No, so if there are any discharges, so most commonly, breast cancer does not cause pain. Okay, I would like to say that again. Most commonly, breast cancer does not cause pain. So that's also one of the main reasons why, especially here in the Philippines, we hear that most patients only come and seek consult when their problem has grown really, really big or has already burst through the skin and cause them other problems, or when they already have really, really extreme pain from metastasis to the bones. So that's the very sad thing, no? Most people think, I'd like to say this, no? My most common reason for patients who seek consult in the clinic is actually not a breast mass, it's actually not breast cancer, but it's breast pain. But as I said, breast cancer does not usually present with breast pain. Of course, unless it has already protruded and ulcerated the skin and caused other problems, or it has already latched itself onto your armpit and there are a lot of nerves in there. So that's usually the case. So again, what do we look out for? We go one by one. If there is a thickening of your skin, that's not usual, not the same as the other parts. If there is an unusual dimpling, so dimple is like, you know, kandi is when you smile and there's a dimple, there's an indentation in the skin. So it's the same for the breast. What does that mean? It just means that there might be something inside the breast that's pulling the skin inward. And this can be usually seen when the person leans forward a bit and looks in the mirror. No, so that's one of the techniques to look. So sometimes it can be seen even without leaning forward, but if your breasts look normal, then I would also suggest leaning forward and looking at the pictures. Other things that we need to look out for are bumps and lumps, definitely. Changes in the nipple area, any lesions in the nipple area. When there is a change in your nipple. So as you can see, one of these is sunken nipple, no? But it doesn't mean that if you already have since you were a child, or since you're menarche, you've noticed that you already have an inverted nipple, it doesn't mean that you have cancer. No, there are some ladies that just have inverted nipples, but there's nothing wrong with them. When we talk about sunken nipples, these are usually the ladies who have normal nipples at the start, and eventually they notice that their nipples eventually stick inwards and eventually turn inside out. So this is a new thing. Of course, when there is tenderness and there is warmth, you have to also go see a doctor, because tenderness and warmth doesn't always just mean infection or inflammation. It may be something else. Orange peel skin is exactly just what it sounds like, no? When your skin changes from being normal and soft and smooth to having all these small it's when the skin becomes edematous, when it's very, very full of fluid, that there is some looks like there's some pock marks and it's very, very thick. So that's orange peel skin. And of course, when there are already sores and ulcerations in the skin. Sometimes also when there is unexpected fluid that comes out from the nipple, this one is not a very, very big symptom, especially if the person keeps on expressing their best. But for a spontaneous, meaning a discharge that you did not express yourself, especially if it is bloody, especially if it is one-sided, then definitely you need to go and see a doctor. So basically, these are the things that we need to watch out for. And if you see any of these, then you have to go seek consult. Okay, so the third recommendation is, if on your self-breast examinations, everything is normal, you just need to continue to be breast aware. Keep doing your self-breast examinations for monthly. For those who already have menopause, all you need to do is choose a day once a month, a day that's likely you can remember, no? So like for every first day of the month, that's when you check it, because you don't have menstrual cycle anymore, right? So for the menopausal ladies, we usually just say, just choose a day. And remember, if that's the day, if like it's my birthday, it's the 2nd, oh, it's the 2nd, I have to check myself. So just keep doing it monthly. And lastly, if you have a normal breast self-exam, you still have to present yourself to a breast care facility for screening. And screening has to be done regularly. So what is screening? A screening is when we actually do active intervention to look for any signs of breast cancer even before you feel it or even before you have symptoms. Huh? That happens, the eye doc? Yes, because if you remember when I discussed the development of breast cancer, it starts out in a tiny, tiny microscopic cell, and it grows big and multiplies and grows big and multiplies until it becomes an actual lump, until it actually invades and spreads, right? So basically, the main reason for screening is we want to catch breast cancer while they're very, very small, so that we can provide management that is not so intensive as compared to those lesions that are already very, very big. No, later on I'll explain more. So why am I showing you this picture? If you look at the left corner, the hand is holding a ping pong ball. If a lady does not usually do regular self-breast checks or self-breast exams, the usual size that a breast lump that can be felt by accident, so usually the history is, doc, the other day I got hit on my breast and I was able to feel this lump. It was because I was hit that there was a lump. But actually, that's not what happened. That lump was there and it was already growing, but because we were not trained to do our own self-checks, it grew to this size. So usually, again, by accident, it's usually ping pong ball size that we catch it. But as you do start practicing and keep doing your self-breast checks regularly, usually a lady who is not a healthcare professional will be able to feel breast lumps about the size of an olive, okay, as an olive, or maybe a blueberry. And compared to a doctor who is well versed in actually doing self-breast exams, who does it on a regular daily basis, whose fingers are already attuned to how a breast should feel, usually we are able to feel breast masses while they are the size of a green pea. And if you look down the line, I think it's quite hard to be able to feel corn-sized lesions. This is a red corn, by the way. A corn-sized lesion inside the breast, especially if it's very deep, or maybe a rice or a sesame seed. But actually, these lesions we will be able to detect these lesions by doing active screening. So these, the smallest sizes here, your sesame seed and your rice, what's it called? The rice, these are usually caught when we do screening mammograms, okay? So what is a mammogram? Basically, a mammogram is an X-ray of the breast. It's just basically an X-ray of the breast. And there's no need to worry about it. Most patients come to us and say, Doc, I don't want to do a mammogram. Let's just do an ultrasound. Doc, I heard that the mammogram is painful. Well, the mammogram, again, is just an X-ray. But if you do an X-ray, just like how we do an X-ray of the lungs, then we won't be able to see the breast, right? So when we X-ray the breast, we have to pull it out from the chest wall. So that's the reason why in the mammogram, they pull out the breast. It's a very uncomfortable position for the patient, but that discomfort usually lasts only a few seconds, at the most a few minutes, no? So they just pull it out, put it in some plates to make sure that we're able to X-ray the entire breast properly, and then they just shoot, and that's it. And they do two pictures on each breast. So that's a mammogram. And why do we do screening mammograms? Again, because we want to catch breast cancers while they're very, very tiny, even before we are able to feel them. So as you can see here, the smaller, the earlier, the better. So basically that's your screening mammogram. For screening, the ultrasound is not a good tool. The ultrasound will be able to see lesions larger than those that are seen by the mammogram, but usually the ultrasound, we only use that for diagnostic purposes, meaning when you already come and present with a breast mass, that's the time we do ultrasound. First and foremost, we want to know if the mass that you actually feel is really a solid lesion that's growing in there, or if it's just a cyst, or all these other things. And it's for confirmation. So if we see something on the mammogram, that's the time we do also an ultrasound. So it's not the other way around, and it cannot be, the screening mammogram cannot be replaced by your screening ultrasound. We don't do screening ultrasounds anymore. All right. And so when do we do our screening mammograms? Usually, so this is usually the misunderstanding. Ladies think all ladies of all ages, but no, we recommend, so there different countries, different guidelines recommend different ages, but usually the guidelines here in the Philippines is we start at the age of 40. So at the age of 40, we should be presenting to the breast care center for a screening mammogram. So as you can see over here, I put there 1 cm, the average size lesion that is found on the first mammogram. Okay, but if you do your screening mammograms regularly, so how often is regularly? It should be once a year. Okay, so if you do it once a year, especially if you do it in the same center, in a center that's known to have good machines and well-trained radiologists, usually we are able to catch lesions, breast cancers, while they are still tiny, even 5 millimeters in size, we can catch them already. So that's the value. That's the reason why we do screening mammograms once a year, every year. And sometimes, especially while I was in Cebu, I would recommend for the patients to do it during the Breast Cancer Awareness Month. Why? Because most hospitals offer discounted prices for these. Oh, and let me go back. If you see, what is this picture of this keychain that I'm putting in? Actually, I just saw this in one of the breast cancer awareness campaigns, no? And it symbolizes the smaller, the better. No, it symbolizes the bigger. If you don't do your screenings, like your self-breast exams and your screening ultrasounds, you just catch them at a bigger size. And if you do them regularly and more often, then you catch them at the smallest size, as you see here in this keychain. So what else? Oh, and definitely it's not enough that we should know if we have something wrong in our breast, no? Because there are many times wherein patients still come at a late stage, even though they've already known they've had breast masses for a long time already. So basically, you want to catch or know if you have growing lesions on your breast, and then we want the patients to come and seek consult with the experts as soon as possible. So I'm really saying you need to seek out experts. Why? Because if you seek out just regular physicians or those that are not so well versed in, as what Tita Mayan said earlier, in all the new and coming treatments and all the things that we can do aside from just the regular getting the breast off, then the patient may not be able to use. I am so sorry. Just give me a second. All right. So if you don't seek out experts, then we are not able to provide the patients with what they need. So as you can see in this illustration, for breast cancer, it's not just surgery that the patient needs, but it's a multidisciplinary, so many different kinds of fields in the medical field and in the nursing field. We need a lot of people in the treatment. There is a team that actually helps the patient. So you need the oncologists, you need the radiologists, the pathologists, everything, no? And so for the treatment, there are a lot of different treatment methods. And because I may have forgotten to tell you this, but breast cancer is not just one entity, no? It's not just one kind of breast cancer. Breast cancer is just a blanket term for the many kinds of cancers that can grow in the breast. So there are different types of cancers, and then there are different kinds of treatments for these different kinds of cancers. And if I would like to ask the organizers if I have a few more minutes. Tita Mayan asked me to talk about some myths for breast cancer. Please.
Last, Doc, we can
Yes.
extend for the last 5 minutes.
Right. So this is this slide shows us the common things that the common misconceptions, no? So most commonly the patients come into my clinic, as I said, they say, oh, I accidentally hit my breast, or I accidentally injured my breast, and that's probably the reason why I have breast cancer. No, so that's a myth. That's not real. Okay, that's not true. Most of the time, that's not true. Now, some patients come in and talk about their bras, and they ask if their bras, the bras with underwires, the wires in their bras can cause breast cancer. So far,
While we are having some technical difficulties, we would once again like to welcome you again to Pink Perspective 2022 with the theme Together We Can Survive. I would also like to acknowledge the organizations involved in this event, the Rotary Club of Cebu Frente Community Base with their president, Philip Joel P. Perez, the Rotary Club of Cebu Frente University of San Carlos Chapter President Reco Maria E. Diaz, the President of the Rotary Club of Cebu Frente University of the Visayas Chapter, Roldan C. Laresan, the Cebu Doctors University College of Medicine, President Kathleen Mariel Rose Y. Alfar, the Community Outreach Resource and Education, or the CORE President, Aislinn Vanna S. Inanaria, the Asian Medical Students Association Accentuating Lives Through Service and Advocacy, or the AMSA-ALSA President, Ira Jade Langkawan, and the I Can Serve Foundation, who are united once again to celebrate the Pink Perspective Year 3 with the theme, Together We Can Survive. Let us give them a virtual applause. We would like to also remind everyone once again on our house rules. A gentle note for those who are in our Zoom conference room, please do mute your microphone unless asked to unmute, and turn on your cameras if your bandwidth permits. This webinar is recorded, thus we must be in our good behavior at all times. Hello, Doc.
hello, I'm very sorry for another inconvenience. I
It's
cannot
totally okay, Doc.
my screen again. Do you need me? Do you want me to continue on that last slide?
Yes, Doc. Yes,
All
please.
right. I still cannot share my screen, so if anyone can help me, please.
Sige, Doc.
I'm very sorry. No, I'm very talkative. This topic is very near and dear to my heart. No, it's not just because it's my profession. I trained extra for this, but I know a lot of people who have had this, and I know there are a lot of things that we can do. So that's why, I'm very passionate about this. All right, so let me continue. Yeah. So, where was I? Only women with a family history of breast cancer are at risk. That's not true. Most commonly, in about 80-85% of the time, breast cancer develops spontaneously. No, so it's important that we know our family history, but it doesn't necessarily mean that if you have no family history of breast cancer, it means that there's no chance for you to develop breast cancer. I'm too young to get breast cancer. That's also a myth. As I said, age is a very big risk factor. As we get older, we get the chances of having breast cancer is higher. But especially for patients who have genetic abnormalities, these are the ladies that develop breast cancer at a younger age. Wearing deodorant, does it increase your risk for developing breast cancer? So far, the studies don't suggest any of this. No, it's not true. So you definitely can and should wear deodorant. Breast cancer always comes in the form of a lump. As we said, we need to look out for changes in the skin or nipple discharges or, edema or what we call peau d'orange, the orange changes in the skin, those things. So lumps are not the only ways that breast cancer can show up. My breast lump isn't painful. It probably isn't cancer. As I said, most cancers do not present with breast pain unless they are already in the late stages. Regular mammograms can prevent breast cancer. Actually, that's also a myth. No, it cannot prevent, but we can catch them earlier. And if we can catch them earlier, we can treat them earlier. If we can treat them earlier, we can increase the chances of survival, right? Mammograms can cause the breast cancer to spread. Oh, this is a very, very, very common thing that the patients say. Doc, I don't want to get a mammogram because it's painful, number one. And number two, doc, I don't want to get a mammogram because people say if I do it, my cancer will spread. As I said, your mammogram is just an x-ray, okay? It's just an x-ray. It's a special term for an x-ray of the breast. So the pressure on the breast, of course, will not push the breast cells out of where it was, right? So it does not cause the spread. Also, another myth is, doc, especially for those patients who've already gone to see a doctor and the doctor says, oh, we have to do a biopsy. Patients would say, doc, dili lang ko. I don't want that because some people say that doing a biopsy will make it spread. Actually, no. So by a biopsy is just a fancy way of saying we need to take samples to confirm or make sure that it's not cancer. So it's an invasive procedure, but it definitely does not cause a spread of the cancer. No, as we said in the development, it already has a natural propensity to spread. All right. And lastly, men can't get breast cancer. Oh, this topic I did not discuss earlier, but I will have to say this is not true. Men can also get breast cancer. Okay, so we just usually just advocate for the lady because of course our breast tissues are larger, right? But men also have breast tissues in their chests, all right? They still have breast tissues. It's just not the kind that we have as ladies. So those breast tissues can also be the areas where breast cancer can develop. And I think I am done. This is the last slide. Together we can survive, but my parting words would be, I took this from somewhere on the internet also. How about we try to focus on thriving instead of just surviving? All right. So thank you. I am your breast friend and breast surgeon, Dr. Kim. And again, I'm open to any questions, but I think I took up most of the time. So if you want, just chat it in and I'll reply. Okay.
Thank you again, Dr. Dario, for being our guest speaker. Like what Tita Gov said, among suki na speaker, but we always learn new things from your talk, Doc, like the importance of being breast aware. Thank you so much for that wonderful presentation. I am sure all of us have learned a lot out from your discussion. Now I know a lot of you may have questions for our speaker, and it's time to drop this question so that our speaker can address them. You can comment your questions on the chat box. Okay, we already have questions here. A direct message from our ACCF-USC President, Reco Maria Diaz. First question is, mammogram is one common method to detect breast cancer. At what age would you recommend women to do it? Is self-exam enough?
Okay. We recommend starting doing a mammogram at the age of 40 and doing it yearly thereafter, especially if you don't see any signs of cancer. Breast self-exam is what we recommend starting at a younger age. No, so usually when you first develop your menarche or your first menses, that's the best time that we teach the young adults to do self-breast exam. So then it becomes a habit. They keep doing it. They already know what they need to do in order to check. But it doesn't mean that once you start doing your screening mammograms, you stop doing your breast self-exams. No. Why? Because your mammogram is not foolproof. Not all lesions can be seen on the mammogram. There's about maybe 15-20% of lesions that cannot be seen in your mammogram. That's why we have to pair it with a breast exam. And so the recommendation is you do your self-breast exams. And for ladies with high risk, so if you remember any of those risk factors that I said, if you have multiple risk factors, especially for family history and genetics, we recommend the ladies to come in and seek clinical breast exam. So it's different from a self-breast exam. It's a doctor this time who does it. Clinical breast exam, 10 years younger from the youngest family member who had breast cancer. Okay, so yeah, I think
There's another question, Doc. Will breast cancer treatment affect a person's ability to have a baby?
okay. The short answer is yes, while you are getting treated. Okay, so definitely we don't want ladies to get pregnant, while they are recovering from surgery, or especially while they are getting chemo treatments or radiation treatments or the hormonal treatments. Why? Because especially for chemo. So let me just put this in. Chemo, for all the drugs that are available in the world, chemo is one of the strongest drugs. Why? Because cancer is one of the strongest diseases that we have to fight, right? So chemo, if we give chemo and then you get pregnant, there's a chance that when you get pregnant, your baby might have abnormalities from the chemo. Okay, so yes, you can get pregnant, but we of course advise to wait a while. So if ladies are diagnosed with breast cancer while they are still young and fertile, another very, very important aspect of breast care and treatment and management in the multidisciplinary realm of breast cancer management is to discuss and offer the options for egg and ovary preservation for young ladies. So what does that mean? So if you get diagnosed with breast cancer, of course, the priority is treating the breast cancer, right? But if you have plans of getting pregnant in the future, and let's say in the timeline, Basin, maybe by the time you're done with breast cancer treatment, then you may already be at the late 30s or 40s na. So before you start breast cancer treatment, usually we recommend preserving your good and healthy eggs in a facility, so that by the time you're done with your treatment, you can try getting pregnant by yourself, of course. But if you cannot, then you have a reserve good and healthy egg that we can use for in vitro. All right, I hope you understand. Yeah.
Next question, Doc. Does having silicone breast implants increase your chance of breast cancer?
All right. So augmentation. The short answer is no, not necessarily. Especially if you get your augmentations from licensed and accredited reconstructive surgeon, breast augmentation surgeons, no, because they use the medical grade ones. But getting silicone augmentation will make the screening process harder. Okay, because it will overshadow, or it will hide if there is a breast cancer that's growing inside, especially if the silicone or the patient gets although it's not one of the good ways to get augmentation, but it's very, very common among ladies. It's called injections, no? So foreign body injections, that one is a very, very big no-no, not because it can cause breast cancer, but because it's very, very hard for us to catch breast cancer if it grows. And of course, we cannot do the regular screening mammograms anymore to be able to screen, but we have to move on to another more expensive screening modality.
Last question, Doc. When I tried to do self-examination before, I felt very small bumps. How do we differentiate the normal bumps in our breast compared to possible breast cancer lump?
Okay, so as I said, we want you to be breast aware. So we want you to know what your breast normally feels like. So for ladies who first feels something, we recommend that you go consult with a doctor, a physician who is well-versed, so that we can evaluate if those lumps and bumps are, are things of concern or not. And then once we have evaluation and we know they are not of concern, then we know that the next time you do your self-breast exams, if you feel the exact same thing, we don't need to worry so much. But having all these lumps and bumps actually also should remind us to check more often, no? Because we don't know if behind or near those old lumps a new lump will form. So we have to keep doing self-breast exams.
Thank you so much, Doc. Due to time constraints, we can't accept questions through Zoom chat, and we'll try to answer them there.
Thank you very much, everyone.
All right, thank you so much, breast friends, for your questions, and I hope that your thirst for knowledge has been quenched. At this point of our event, we would like to present the Certificate of Appreciation to our speaker. The Certificate of Appreciation is hereby awarded to Dr. Kim Gonzalez Daroy for her phenomenal and worthy presentation on the topic Breast Cancer 101 during the Pink Perspective 2022 with the theme Together We Can Survive webinar held on October 29 to 30, 2022 via Zoom. Given this 29th day of October 2022, signed by the President of AMSA-ALSA, Ara Jade C. Langkawan, the President of CDU-CM SC, Caitlin Y. Alfar, the President of CORE, Aislinn Veda S. Ananoria, the President of RACCF, Philip Joel P. Perez, the President from RACCF USC, Reco Maria A. Diaz, and the President from RACCF UV Chapter, Roldan Lerasan. Once again, thank you so much to our dear speaker, Dr. Kim Gonzalez Daroy, for sparing us your time, effort, and knowledge for our event today. So at this time around, may I request our dearest breast friends to please turn on your cameras for the photo opportunity. Could we have Rotaraactor J and Vianney Dagandan to take the pictures, and make sure to show us your biggest and magnanimous smile.
Doc Kim, thank you so much, Thank you.
Thank you for
Okay.
the invite, Tita Mayan. Thank you.
Can
Suki
we,
yun, Suki.
I'm sorry, I overshot my time. Nobody stopped me. Nobody stopped me. I'm very sorry.
okay, so can we open our cameras? So I'll be taking the pictures. Okay, so so we have 4 slides. So can we have the first line? Okay. 1, 2, 3. Second slide, 1, 2, 3. Next slide, 1, 2, 3. And last slide, 1, 2, 3. Thank you.
Thank you, JN. Doc Kim, thank you. Regards to Doc Mark and the kids.
We'll send you regards, Tita. Thank you.
Okay.
Welcome again to Pink Perspective 2022 with the theme Together We Can Survive. Our number of participants is increasing. Good morning to everyone in the Zoom. Well, it's good to know that you guys are still here and still ready to listen to our next speaker. Without further ado, please help me welcome Miss Celine Maya Rose Du to introduce our second speaker for today.
Hello, can you hear me? Hello?
Yes, you're audible.
Yes, thank you. So good morning, everyone. My name is Ira Jade Silangkawan. I'm the president of AMSA ALSA from Cebu Doctors University. Please forgive me for my hoarse voice. We actually have intrams week and I have been cheering all week. So medyo pagaw jud ta karon. So together with Miss Celine Maia Rose Du, our beautiful public relations officer from AMSA ALSA, as well as the entire AMSA ALSA family, a rainy, wonderful morning to everyone. We are very glad to be part of this event once again. Thank you for inviting us back. Please pardon again ako pagkapagaw, and I will try my best to present the next speaker very well. So I'm very happy to join all of you here virtually to talk about such a relevant conversation regarding breast cancer. So having attended Pink Perspective since year 1, it's amazing to see how much we've grown on this journey for 3 years as we continually recognize the importance of not just being aware, but also actively advocating for early detection as well as support for our breast friends, because we all know how important it is to have a good support system. So without further ado, I'm very honored to present our next esteemed speaker for today. So she currently works for the Department of Health. She is the Director 4 of the Malasakit Program Office. She has a very colorful and wonderful work experience. I'll start from 2000 to 2003. She was the Executive Secretary to the President. In the year of 2003 to 2007, she was a Business Development Supervisor. In 2007 to 2015, she was a corporate sales head in Sunstar Publishing Incorporated. In 2015 to 2020, she was the branch head of Sunstar Publishing Incorporated in Karkar City. In 2018 to 2020, she was the executive assistant in the Office of the Presidential Assistant for the Visayas. And in October 2020, she was the Assistant Secretary for the Office of the President, and currently she is Director 4 in DOH Malasakit Program Office. For her voluntary work and involvement in civic organizations, she's a part of Philippine Red Cross Cebu Chapter, a board of director. She's also a part of the Advisory Council for the Regional Mobile Force Battalion 7. She's also part of Sebeco 1, Multi-Sectoral Electrification Advisory Council, or your MSEAC, a member of Civil Service Eligibility. She was the #1 Barangay Perelos Counselor in 2013 as well as 2018. For recognitions, she was a nominee for the Outstanding Barangay Official of the Year, or TOBOY, in Cebu Province from December 2014. Ladies and gentlemen, I'm very honored to present Director Girly Enriquez Veloso. Good morning po.
Good morning, Miss Ira. A very colorful and long introduction indeed. Maong sadta na.
Morning, Direct Girly.
Ay, bisag sa tanan. Before I start my presentation, let me share my presentation para mag-diretso-diretso ta. Nakita na?
Yes, po.
Okay. Okay. Sige. So, a stormy day to each and every one of us. I'm here in Manila. The weather is bad. Kusog kaayo ang uwan. And I guess the same weather conditions at siguro sa Cebu, no? Cebuan uwan. I hope and pray that you are all safe wherever you are now. And I also hope and pray that my internet here will cooperate until the end of my presentation. Dili unta ako mawagtag kalit. But for the meantime, let's sit back, stay put, and discuss how we can help each other. Okay, so first of all, I would like to thank the Rotaract Club of Cebu Fuente, CDU College of Medicine Student Council, and of course, I Can Serve Cebu, most especially my good friend, fellow director of Philippine Red Cross Cebu Chapter, Director Governor Mary Ann Alcordo Solomon, for inviting me for the third time, katulo na gid in town, soki na gid ni, to share with you and update you of the Malasakit Center. It is truly an honor and a humbling experience every time na ako diri ninyo. And of course, happy gyud ko, and I always look forward for this presentation every year. Cancer is indeed one of the major health concerns of our country. Cancer treatment can also be financially challenging to patients and their families. And this is where one of the program of our government comes in, the Malasakit Center. Okay, so the Malasakit Center Act, or Republic Act 11463, was signed into law last December 2019 by no less than then President Rodrigo Roa Duterte. What is a Malasakit Center? It is a one-stop shop facility within the premises of the hospital where the different participating agencies receive and process requests for medical and financial assistance for indigent and financially incapacitated patients. Where can you find the Malasakit centers? DOH retained hospitals. In the country, we have 72 DOH retained hospitals. So kanang DOH retained hospitals na ana siya Malasakit Center. Selected SUC hospitals or state university and colleges hospitals. Selected LGU hospitals and also military hospitals. All four agencies, namely DOH, PCSO, DSWD, and PhilHealth, are inside the Malasakit centers. You can all find all four agencies inside the Malasakit centers. Who can avail assistance from the Malasakit centers? Only patients, please take note of this, only patients of the hospital with a Malasakit center, outpatient or inpatient, which are assessed by the designated medical social worker and are as classified as indigent or financially incapacitated individuals may avail of the assistance from the Malasakit Center. How to avail assistance inside the Malasakit Center? Number one, magpakonsulta or magpagamot sa hospital na may Malasakit Center. Magpakonsulta, meaning to say, you go directly to your physician or the doctor in the hospital or the emergency inside the hospital with a Malasakit Center. Number two, after the consultation, magtungo sa opisina ng Malasakit Center sa loob ng hospital upang matugunan ang pangangailangang medikal o pinansyal. So, nauna yung magpakonsulta. After the consultation, if you are given a prescription, then you go to the Malasakit Center. If you are advised for an admission, then you will just upon admission, you will just avail the charity ward, and you don't need to get a private doctor. So you can avail of the assistance from the Malasakit Center. Then magtungo sa opisina ng Malasakit Center sa loob ng hospital. Number 3, sumasailalim sa isang interview at assessment na nakatalagang social worker ukol sa iyong pangangailangan. So this will come in, itong number 3 will come in upon discharge. Number 4, magsumiti ng mga kinakailangang dokumento para makatanggap ng benepisyo. Number 5, tanggapin ang aprobadong benepisyong medikal o financial. That's how you can avail of the assistance inside the Malasakit Center. As of today, as of September 2022, we have 152 Malasakit centers nationwide, 86 of which is in Luzon, 29 is in Visayas, and 37 is in Mindanao. The Department of Health inside the Malasakit Center provides medical assistance to patients. We call that MAIP, or the Medical Assistance to Indigent Patients Program. What are the service coverage of MAIP? Please take note that all must be prescribed by a physician. Number 1, drugs and medicine. Included in the PNDF, or the Philippine National Drug Formulary, and those which qualify for compassionate drug use in compliance with the criteria of requirements set by the FDA or the Food and Drug Administration. Number 2, coverage of MAIP: laboratory, imaging, radiological, and other diagnostic procedures. Number 3, blood and other related blood screening products. Number 4, all clinically indicated medical, surgical, high-risk cases of obstetrics, gynecological, ophthalmological, dental, implants, medical devices, and supplies, and other related procedures. Number 5, prescribed post-hospitalization, rehabilitation services, aftercare program, appropriate mental and psychosocial support. All hospital bills, including professional fees, provided that the expenses for the professional fees shall not exceed 50% of the approved amount of medical assistance. Document requirements inside the Malasakit Center or upon availing the medical assistance for indigent patients program. For inpatients, total charges and assessments of medical social worker of the hospital. For outpatients, physicians' prescriptions, request and assessment from the medical social worker. Referred patients, inter-hospital referral form with attached physician's prescriptions, request, medical certificate, or clinical abstract. And last but not the least, for the referred patients, patients who are requesting drugs and medicines should be examined again by the physician of the recipient hospital. I really have a very short presentation because, as I've said, pangatlong presentation ko na to, 3 years na akong pabalik-balik. I wanted to give ample time for the question and answer because based on my experience, that was the kana mo pinakadugay na tong take time taan ng question and answer. But lastly, I would like to inform everyone that my team here in the DOH Central Office are currently coordinating with another office here in DOH, which is the Cancer Office, to streamline the availment of Cancer Assistance Fund, or CAF, which is an additional budget line item to ease the financial burden of our cancer patients on top of the medical assistance from our Malasakit centers. All of these efforts are, of course, only possible if we work together and strive towards better governance and utilization of government funds for intended recipients our indigent and financially incapacitated patients. Admittedly, the fight against cancer is not an easy one. But if we put all our coordinated and people-centered efforts together, I truly believe that we can positively make an impact of our lives of our cancer warrior patients and their families. So to everyone present, daghang salamat. Rest assured that the Department of Health are doing its very best to give everyone and Juana a quality healthcare service. We may be the lead government agency mandated to ensure the promotion of health for all, but we're also counting on each and every one of us to achieve the said goal, because together we can survive. Okay, I think that's all for my presentation. Wa gyud nako taasa kay para magstorya tag taas-taas. Daghang salamat.
Thank you for that very insightful discussion about the Malasakit Act, or the RA 11463, Director Girly Enriquez Veloso. Now, I know a lot of you may have questions for our speaker, and it's time to drop this question so that our speaker can address them. You can comment your questions on the chat box.
But before we will proceed with our question and answer, I have a copy of the presentation, which I emailed it to your secretariat, as well as the list of the Malasakit centers nationwide, Luzon, Visayas, and Mindanao. So for those who want to get that copy, just get it from your secretariat. Salamat.
Salamat, Director Girly. Neslan, may I start?
Yes, Tita Gov, you can.
Okay, thank you. Director Girly, daghang kaayong salamat. You know, Malasakit, never-ending daghang kaayong pangutana. There's so many questions. Yeah, we really like to thank you for, even if pabalik-balik on the third year, we still get the same questions from fellow newly diagnosed survivors. And I'd like to share it with you. One is, to simplify things, is there an online form that they can just fill up ahead so it will be easy when they go to the Malasakit Center?
For the online form, we don't have that. Why? Because it's very important, as I've said, for the social worker to see and assess the patient before they can avail of the Malasakit Center. So it's really face-to-face. Face-to-face. After they see their physician.
Second, on the social worker, how many social workers are assigned in the Malasakit Center, and from what time to what time? Apparently, there have been comments that sometimes the social workers are not around when they go to the center during office hours.
For the number of the social worker, it really depends on the capacity of the hospital. Now, if we're talking with Vicente Soto, more or less they have, if I am not mistaken, 30 social workers of the hospital, not specifically inside the Malasakit Center, but the whole hospital. So as I've said, there are 4 agencies inside the Malasakit Center. Each agency will bring in their representative. For the hospital social worker, mag-igo ra gyud siyang mag-assess. But the rest of the manpower inside the Malasakit Center, they are not social workers. 1 or 2 social workers are good inside the Malasakit Center. The rest are representatives from the agency, because we don't need a lot of social workers inside. Okay? We're more of a financial assistance. So a social worker is just to assess if unsay sakit sa patient, and then records upon admission of the patients. So more gyud na siya works as social worker. The rest from the representatives of the agency.
Last 2 questions while the others are formulating their questions also. When you say that there are 4 agencies in the Malasakit Center, is it okay if they can just go to one agency and have that agency finance them without going to the Malasakit Center? Let's say they want to go to a hospital, another hospital of their choice. Can they still go to a certain agency like PCSO to get assistance?
Yes, definitely. The objective of the Malasakit Center is to zero the patient. The reason why ma-zero si patient is because all 4 agencies inside the hospital, nag-ambag-ambag na sila. They contribute each other. So let's say, for example, I'll just state let's say 50,000 bill. So upon entering the Malasakit Center, the first agency who will assess is the PhilHealth. So let's say, for example, PhilHealth is 10,000. The remaining bill is 40,000. PCSO will give 10,000. So the remaining is 30,000. DSWD will not deduct the bill of the patient. Okay. Kuan man na sila transportation, food allowance. So mo na siya ang hospital ang sa DSWD. So the next agency who will zero the bill of the patient is the DOH. So all 4 agencies imo gina siyang sudlon or duulon because they are all inside the Malasakit Center. You don't need to go out of the hospital to avail of the other agency assistance, but all 4 inside. So okay ra gid siya nga nagtupad ra man na sila.
Okay, so 4 agencies nagtupad. Ang role sa Malasakit Center is holding.
Yeah, the Malasakit Center is an office wherein all 4 agencies giso dinha to give financial and medical assistance to our patients.
So Malasakit office does not give any financial. It only comes from the 4 agencies.
Yes.
Okay, my last question, kasi we're having more questions now. This is also as I briefed you, because Malasakit Center was formed and organized in 2019 during the term of then President Digong Duterte, Rodrigo Duterte, and with Senator Bongo. Will this still continue under the new administration? Are we assured that Malasakit Center will continue in the new administration?
Definitely, Director Mary Ann. Why? Because it's already a law.
It's a law. So
I
hope it is clear to those who texted me now and who texted me before.
Yeah. In fact, we have the priority lang right now are the DOH retained hospitals. We have identified 8 DOH hospitals aside on top of that 72 hospitals of DOH. We have newly renationalized DOH hospitals. So we are prioritizing this. Unahon na mo silang abli for the first quarter of next year. Then we will going to open more Malasakit centers in other LGU hospitals. So
Yay,
yes,
nice
definitely mudaghan pag yun atong Malasakit centers.
Thank you so much, Direct Girlie. Back to you, Nestlin.
Thank you, Director Mayan.
Thank you so much, Tita Gov. Now, Director, there's a first question from RACCFUSC President Recco Maria Diaz. Up to how much can one avail in the Malasakit Center? Can they avail it more than once?
Yes, definitely. If lain-lain lang ang sakit, maka-avail ra gid siya. Let's say, for example, if you are admitted this month and to say the following month, ma-admit na pud ka in the same hospital, you can still avail. But there are one agency inside the Malasakit Center that you can avail of their assistance, I think once in 3 months, which is the DSWD. So because of the, of course, no, mahurot man sa ilahang funds kung ilang gisigi o the same patient ilang hatagan within 3 months. So naa sila once in 3 months nga assistance ihatag for the patient. So only the SWD, but the rest you can avail of the Malasakit successively.
All right, next question, Director. Could we avail malasakit even if it is outpatient?
Yes, yes. Outpatient and inpatient, as long as you're a patient of a hospital with a malasakit center. Because right now, actually, na-agate siya yung misunderstanding, no? Na other patients, they were admitted in their provincial hospital without a malasakit center. And then adto sila Vicente Soto to avail of malasakit center. So definitely they cannot avail of the assistance because they are not a patient of the hospital. But kung magpa-patient sila sa hospital as an outpatient, so na sila yung record sa hospital, itanaw ana sa social worker, they are now in the system. So maka-avail na sila sa malasakit center. So only patient of the hospital with a malasakit center.
Another
I hope that's
question.
clear, huh?
Another question, Director, from Marilu. How extensive and or credible is the assessment of the social worker? I know that palakasan many times is what's happening.
I don't think siguro I cannot answer I cannot answer that, but we serve a lot of patients, no, 3 million patients since we started our malasakit center. So I guess daghan gitag natabangan. It's not just palakasan or something, no? So we are just basing on the number of patients served inside our malasakit center. And siguro nadunggan po na ninyo sa inyong mga neighbors and friends that they really availed of the services of the Malasakit Center.
Another question from Kim Gonzalez. How long can you live with progressive breast cancer without treatment? It depends on the aggressiveness of the kind of breast cancer and on the stage of the breast cancer and presentation. Without treatment, it will continue to do its thing and it will only be a matter of time.
I guess, Murag, I'm not the right person to answer this. Mag-doctor ako.
If I may interrupt, yes, if I may interrupt, I'm just
Yeah, Doc,
answering a
please.
previous question. Yeah.
Okay, I'm sorry.
It's okay, it's okay.
I think there's no question on the chat box right now.
No other questions? Wait, I will go to my chat group, the I Can Serve
Okay,
chat group, because there were so many questions before raised about malasakit. At least it was clarified by Director Gurley that there are 4 agencies who can help the patients. They have to be in that hospital, either outpatient or inpatient, with a record in their system. And except for DSWD, they can continuously ask for aid. DSWD is only after 3 months, correct? Is there any way connect to have a malasakit card? Would it be possible to fast track everything?
Actually, we do have a malasakit card on the first year of Malasakit Center, but it was prone to abuse. And we wanted also na wala siya gipili because maluoy ta sa uban nga wala sila malasakit card, maawit sila og avail of the malasakit. So it is for everyone. So manaa kay card ug wala maka-avail rigid sa malasakit. So we discourage the use of card for the Malasakit Center.
Very timely, Director Gurley, because one of our banner projects in Pink October is the Pink Room in SM City. This is the breastfeeding room transformed into the Pink Room where anyone, any walk-in patients can go in. And it broke my heart. I was on duty that afternoon. There was an elevator girl, elevator lady, who's living one day at a time with their payroll. And it was confirmed she has cancer and she needs a treatment. can we refer her to Malasakit Center? I can just give you her name.
Yes,
Because one is
definitely.
really
Can you
indigent. Indigent, she's indigent. The husband does not have any work. She has 3 children and she lives, if she works, she's paid. If she does not work, she's not paid. So it took her some time to go to the doctor because she had no transportation budget. So we had to help out, and yeah, very, very kawawa. We would like to help her out by referring her to you.
Yes.
Okay.
For these cases, no, I think it's best for them to go directly to the hospital and have themselves checked by a physician. Once they have a prescription or kung unsay advice sa physician sa ilaha, then they can go to Malasakit Center.
Okay. Okay. Thank you. Thank you.
Important lang gid siya nga the doctor in the hospital with a Malasakit Center can check the patient first. They
Okay.
don't need to go directly to Malasakit Center, no, because Malasakit Center, ang ato ang gihatag there is the financial and the medical assistance. So
All right.
most cases upon discharge na come in. Important if you have friends and family members na ay gibati sa kalawasan, have yourself checked. Okay, that's number 1. You have yourself checked in a physician inside the hospital with a Malasakit Center, and after that, dito na ta sa Malasakit Center for financial assistance.
I think there's a comment on this case. She went to the Malasakit Center, pero mahaba, may number pa. Until now, she has not been entertained.
Unsay, what is that assistance nga na ay number? Maybe
Can you enlighten me, Maria, on or I don't know if Baby is here or Ron, on the elevator girl, why she was not yet entertained sa Malasakit?
Because usually ang taas nga linya is the procedure sa hospital, like the MRI, the CT scan, taas gid siya nga linya because public hospital, and in fairness to our DOH hospitals right now, maayo na gid ang mga services. It's just lang daghan lang kaayo pasyente, so taas gid ang linya sa availment of the procedures. Pero I just want to be clarified kung unsa na siya nga mahaba, because definitely it's not, yes, taas-taas ang linya sa Malasakit Center, but dili ka pabalik-balik yun. Pabalikon sila ka kausap, pero we discourage that. So, oh yeah. Oh, it's the procedure good. That's beyond me already. Sa hospital na siya. Sa hospital siya nga pabalik-balik tinuod ang procedure. Kay pasyente. Any other questions?
Yes, Director. What are the hospitals that has Malasakit Center in Cebu?
Okay, again, no, the list of all the hospitals are with the Secretariat. You can get a copy of it. But in Cebu, we have, if I'm not mistaken, 6 Malasakit centers. Number 1 is Vicente Soto. Second is in Cebu South Medical Center, or the former Talisay District Hospital. Para sa mga nakay, nasa tayo St. Anthony Mother and Child. Somewhere in Mandaue, we have the Eversley Sanitarium, and we have also in Lapu-Lapu District Hospital, and we also have one in Karkar Provincial Hospital. So we have 6 Malasakit centers in the whole Cebu province.
Another question, Director. Thank you so much for that. How different is the benefits one can get from the Malasakit Center and the Universal Healthcare Act?
The Malasakit Center is a complement siya sa Universal Healthcare Act. I'm not so privy with the Universal Healthcare Act, but the Universal Healthcare, Mango, there's a case rate. So the target of that UHC beneficiary is 0 gihapon si patient. Now, if dili siya ma-0, that's the time the Malasakit Center will come in. So nag-complement ra na ang duha. There's no competition at all. Nagtabang ra gyapon si Malasakit para ma-zero nato si patient.
Thank you so much, Director. Next question. Does Malasakit Center have a quota for the day?
No, wala siya quota. Most probably the agency inside the Malasakit Center na sila cut off. But as to the quota, I don't think so. Wala siya quota.
Thank you so much for that, Director. I guess there's no other questions. Thank you to our participants for your questions, and I hope that your thirst for knowledge has been quenched. At this point of our event, we would like to present the Certificate of Appreciation to our speaker. The Certificate of Appreciation is hereby awarded to Director Girly Enriquez Veloso for her phenomenal and worthy presentation on the topic Malasakit Updates during the Pink Perspective 2022 Together We Can Survive webinar held on October 29 to 30, 2022 via Zoom. Given this 29th day of October 2022, signed by the President of AMSA-ALSA, Ara Jade C. Langkawan, the President of CDU-CMSC, Caitlin Y. Alfar, the President of CORE, Aislinn Vanna S. Inanoria, the President of RACCF, Philip Joel P. Perez, the President of RACCF USC, Reco Maria A. Diaz, and the President of RACCF UV Chapter, Roldan Lirasan. Once again, thank you so much to our dear speaker, Director Girly Enriquez Veloso, for sparing us your time, effort, and knowledge for our event today.
Thank you very much. It's an honor to be here for the third time. Salamat.
So at this time around, may I request our dearest breast friends once again to please turn on your cameras for the second photo opportunity. May I call on Rotaract G and Vianney Dagandang to take pictures, and make sure to show us your biggest and eye-catching smile.
Okay, for a while. Can you open your cameras? Okay, so on standby. Slide 1. 1, 2, 3, smile. Slide 2. 1, 2, 3, smile. Slide 3. 1, 2, 3, smile. And last slide. 1, 2, 3, smile. Okay, thank you.
Thank you, JN. Director
Salamat.
Girly, thank you.
Salamat.
Save the month, October 2023.
Yeah, see you next year.
See you next year.
Love, love, love.
Mwah. Love, love. Hi, Karen. All the way from Cagayan. Thank you for joining.
All right, and that concludes our first day for the Pink Perspective Year 3 Together We Can Survive. We would like to once again thank our speakers for today's event, Dr. Kim Gonzalez Daroy and Director Girly Enriquez Veloso, for teaching us topics that are enlightening and perceptive. Before we end our program, may I ask everyone to turn on their cameras for our final opportunity, and I encourage all of you to do the kamay sa dibdib and put your right hand to your chest to show our support in raising awareness about breast cancer.
Okay, can we open your cameras once again? Dili lang ko mukha may sa dibdib kay maglisod ko. Screenshot. Okay. Page 1, ready? 1, 2, 3. Page 2. 1, 2, 3. Page 3, 1, 2, 3. And last page, 1, 2, 3. Okay, thank you.
Thank you.
We would also like to thank the Rotary Club of Cebu Fuente, the Rotary Clubs of Cebu Fuente Community-Based, USC and UV Chapter, the Cebu Doctors University College of Medicine, the Community Outreach Resource and Education, or CORE, the Asian Medical Students Association Accentuating Lives Through Service and Advocacy, or the AMSA-ALSA, and of course, the I Can Serve Foundation, who are united once again to celebrate the Pink Perspective Year 3 with a theme, Together We Can Survive. It has been a pleasure having all of you here in our journey of raising more awareness about breast cancer. I would like to remind everyone to don't forget that there's another set of speakers, games, and another set of raffle draws for tomorrow's event. See you all tomorrow. Once again, this has been Neslin Canonigo, your host, and allow me to borrow this quote from Jacqueline Smith. Having cancer does make you try to be better at everything you do and enjoy every moment. It changes you forever, but it can be a positive change. Thank you, stay safe, stay inspired, and God bless us all.
The I Can Serve Foundation promotes early breast cancer detection through high-impact information campaigns and community-based breast cancer screening programs. Its flagship project is Ating Dibdibin, or Take Your Breast Care to Heart, a partnership with local government to institutionalize early breast cancer detection. Ating Dibdibin is a comprehensive program from training of government medical personnel all the way to free and affordable cancer treatments. To date, I Can Serve has educated more than 22,000 women, conducted free breast clinics to nearly 10,000 women, and trained more than 1,600 government medical personnel. The only program of its kind in the country, Ating Dibdibin has partnered with the cities of Marikina, Panabo, Taguig, and Muntinlupa. I Can Serve conducts simultaneous nationwide forums in the program called Oktober. It has partnered with schools, churches, offices, villages, hospitals, and local governments.
Early breast cancer detection saves lives.
That goes for men and women.
Breast cancer is the #1 cancer in the Philippines, where incidence is among the highest in Southeast Asia. The I Can Serve Foundation thanks you for helping save lives. Thank you for giving help and hope to women living with breast cancer. Thank you for walking with us.
Congratulations to all. Thank you. Thank you.